Hi, welcome to today's podcast. I'm your host Femi. Today we are having Dr. Vijaykumar with an impressive experience of 16 years from AIMS Institute, Delhi, to explain in detail about ankle foot issues and other common problems that young girls like me face in our daily lives. So let's get started and learn from the best. First thing I want to ask Dr. Vijay is that regarding bunions, it's kind of a bump that is on a big toe, mostly seen in female models or those are wearing high heels. They are facing these common issues in their life. What is it exactly?
Good question, Femi. Thank you for a kind introduction. As you rightly mentioned, these bunion are a bump in the big toe. In medical terminology, it is called as Hallux Valgus.
Okay.
As you said that it's common in young females, and I have seen that many young females from fashion industries or airline industries or from a celebrity point of view, they come and seek advice or opinion regarding the bunion. To tell you exactly why it happens, many times we have seen that it runs in the family. We say it is a genetic or a familial, and also it is the risk increases when the girl wears a heel or a narrow shoes, which this squeezes the toes to one place and it displaces the toe and causes bump in the toe.
Okay.
So family is one reason.
Okay.
Over that, lifestyle issues like narrow shoes or a heel for a longer duration, which increases the risk of a bump in the toe or a bunion.
Okay. What are the preventive measures? Are there anything like preventive measures?
To tell you exactly about the preventive measures, as I said, it happens because of narrow shoes and a high heel shoes for a longer duration.
So-
That is one thing that you can avoid or minimize the use of those things to prevent it, especially the fashion industry people.
So, like, what are the procedures if at all a female or a young woman is facing this thing with a bunion? So, what can she do? What are the like surgical measures or something, or is it physio related? Can be done something like that?
Yes, because this psychologically affects them. Bunion. One, because they cannot show that bump in the toe to everyone, so they want to hide it.
Yeah.
So it affects them psychologically, one issue. The second issue would be in a long term when they have same problem, if they don't get treatment for a long time, say for 5 years or 10 years, it causes problem in the knee pain or back pain, and there is some alignment issue in the spine or in the lower leg. So definitely they should get advice from the expert and they should get treated and make it straight.
Yeah. Coming to the treatment, what kind of treatments are available in the hospital sector right now?
Okay, so traditionally people used to do a very big open surgery.
Okay.
They used to cut throughout the length of the big toe,
Okay.
and it's a very big open surgery which they used to do traditionally, and they make it straight from a bunion.
So I assume a long cut in the sense it's going to disfigure the leg again, right? It's visible, the long cut, the scar marks remain.
Yes, exactly. That is the reason many young females, they don't go for surgery. They suffer it
Okay.
because nobody likes the scar, especially the big long scar in the foot, which many people, they pamper their feet.
Yeah.
So long scar, it affects them. So that is the reason they don't go for surgery or they don't seek attention of
Okay.
a doctor. So they keep suffering, and long term it affects their lifestyle. So I would advise we have a modern technique and technology that as I was discussing with you
Yeah.
before this podcast started, like I invented a new technique other than open surgery.
AIMS.
Yes.
Yeah, just tell us more about this AIMS technique that you
Yeah. So when I noticed that many young girls, when I was in AIMS Institute, I used to see that many girls, they come and take advice, but none of them are willing to go for surgery.
Okay.
Because in 10 years back, I used to do open surgery. Even I was hesitant to do open surgery because it gives very bad long scar. Then it struck to me is there any technique where we can have a straight toe without having a long scar?
Yeah.
That's when I started thinking, and I had a tool to do a very scarless surgery, and I started doing this scarless surgery for all these female patients.
Okay.
So then I noticed that the willingness to surgery has increased, and till now I have done more than 50 feet surgery, and they come happily, and say that even if I have a same problem in other toe, I am willing to undergo surgery.
Okay.
That shows that this scarless surgery, which is called as Ames technique, is very appealing. It makes your toe straight, and at the same time there is no scar in the
Less ugly.
Yes, exactly.
Okay.
So this is the image that I'm showing you, is the big toe before surgery, and you can see that it's a very tiny 2-3 dot scars,
Okay.
which is making them a straight, and they are very happy patients.
So doctor, now coming to flat foot, what exactly do you mean by a flat foot? I've heard from others saying their kids are having infants or in a child, there's no visible arch, and the heel next in between the heel and the toe. There's supposed to be an arch, but
Yes.
here in kids it's flat. And what exactly is that regarding flat foot?
So, as you rightly mentioned, the arch which is supposed to be there between the heel and the toes is missing in flat foot. That's what parents are concerned. Or many times you have heard that their neighbors or their uncle, aunt, or parents themselves, sometimes they see that the arch is missing and they start worrying. And many parents come to us saying that, doctor, my child doesn't have an arch, it has a flat foot. What to do?
Yeah.
So the main concern which I feel should not be so much in a pediatric or in children, because this arch keeps maturing till the age of 10 years.
Okay.
So until the age of 10 years, we are not so worried unless it has severe flat foot where foot is completely deviated outside, or sometimes flat foot associated with many syndromes. There are multiple disease there in the baby, like congenital heart problem, there's a congenital lungs or a brain problem. Only in those babies we need to worry. Otherwise, the active, walking, running child, we need to wait until 8 to 10 years till the arch becomes mature.
Okay.
So till then we need to assure the parents that it is not a big problem. Most important other than assuring is doing some foot exercises. That is very important for the maturity of the arch.
Okay, so then you're saying that exercises alone can improve the
Yes,
healing.
exactly. Till 10 years of age,
Okay.
exercises and a reassurance of the parents that it is going to become normal till 8 to 10 years of age. Only if it persists beyond 10 years.
Okay.
That's what we call as adolescent flat foot. Then we need to think about what to do regarding those flat foot.
Okay. Okay. Now coming to these adults or adolescent girls or kids having this same issue with flat foot, now it's a major something to be concerned about.
Yes,
right?
exactly. Something to concern about if the flat foot remains after 10 years or 12 years of age. That's when they need some attention from an expert or an ankle foot expert, because general orthopedician will not be having so much of depth knowledge about the flat foot. So experts in the field of ankle foot are the right person to approach for a treatment or to seek what to do. In those children's, they start having a pain. Like you have heard that my child from morning to evening will be normal, she'll be playing. When she or he comes back to house after sports or after play, they start having pain in the calf area, pain in the foot area. So that is because of a flat foot, a persistent flat foot, where there is abnormal biomechanics in the foot that is causing a weakness in the muscles, or the muscles are not working in an optimum environment. So they start suffering, starts with the pain, especially in the calf area and the foot area, and gradually it increases. So if you don't treat those children, they suffer eventually.
So pain is the only thing
Yes,
you experience when
yes,
it's flat
yes,
foot.
exactly. Pain is the major thing. That's what they bring to the doctors.
Okay. Is surgery necessary to treat flat foot?
Yes. Most of the babies who doesn't recover or pain increases gradually over a period of time, they need some kind of intervention.
Okay.
So traditionally they used to do a open surgery and concepts are not clear, so results are very not so good. So now the concepts have evolved and concepts are clear, and now we can do again a minimal invasive surgery in flat foot, where we can give a very good functioning painless foot for the children.
Fine. Also, this flat foot is a symptom for other diseases, right?
Yes, it can be a symptom for other diseases.
So generally the surgery, even if there's a plan for surgery, the child requires surgery, it's only decided once after 10 years or something.
Yes, most 90 to 95% of children, they need surgery after 10 years. Only a few babies or few children, they need surgery before 10 years. For that, you need to come and seek a opinion from my ankle foot experts. So they will decide, they will tell you when and what you need to do.